Hi, I'm Dr. Paul, and thank you for tuning into this video by Waterfront Dentistry by Paul's. Today I'd like to talk to you about the coronavirus and what my staff and I are doing to help make sure that all our clients and, again, staff are protected. Now, until otherwise told by public health or the RCDSO, which is our governing body, it's business as usual, and by that I mean we basically need to judge the risk factors and take care of things that we deem are fit in-house. Let's talk about dentistry as a profession. Now, with seeing your hygienist or when you see your dentist, you got to realize that there is a lot of aerosols with what we do. Now, aerosol basically means air and solution, or in this case, water. So when a dentist uses a drill or when a hygienist uses an ultrasonic instrument, you need water to cool the tips of these instruments. Now, when you work in someone's mouth, this results in an aerosol being liberated from these tips. Now, this is the reason why dentistry as a profession is a little more high risk with something like the coronavirus, which again is being transmitted by air droplets or water droplets. And this is again why I decided to make this video. Now, as far as the virus itself goes, it's designated a pandemic. A pandemic is a new pathogen that the human body has no resistance for via antibodies, and it's spreading geographically more unexpectedly than previously thought it would do. Now, that being said, the virus itself is not catastrophic until a certain immunocompromised level. Now, if you're younger than a certain age or older than a certain age or have just a very immunocompromised situation, you definitely or most likely will get better from having a coronavirus infection. Now, also the situation is this is a fairly new virus, so not a whole lot is known about this virus, but from what we are made to understand as of now, the reason why the entire world is trying to be more vigilant is not because it's deadly or catastrophic, but because we don't want to overwhelm our existing medical care system. Now, think about it. If you have a situation and you need to go to emergency department, most of the time you are waiting because they're overworked. Now, add in the factor that a lot of people who are older or younger than a certain age or who have certain amounts of immunocompromised health status, now if all of them are affected by the coronavirus, they all need to be rushed into the hospitals, and this is the main reason why we as a country or a society or even as a nation are trying to make sure that the lesser number of people infected, the better. So I hope that makes sense. It's not a huge dire straits situation where everyone's going to die who get this virus, but it's just a situation where we're trying to minimize the number of people being affected. Now, what we're doing in our office is, apart from wiping down all our stations after we're done with procedures between clients, we follow something called universal precaution. Now, what that basically means is we look at each and every individual as possibly having hidden pathology. This is something we've always followed, and I'll show you a whole whack of photos where we have things like PPEs or protective barriers on all our equipment, and we also use wipes to wipe down the entire office after. Now, in addition to what we already do, we're implementing this new protocol wherein we're trying to screen people coming in. Now, if you have a look at these photos, we have two entrances, and what we are doing is we have a personnel or a staff member with a thermometer wherein we check the temperature of all the clients coming in right from the first entrance. Now, before you even open the door, we have hand sanitizers laid out so that you can use them, open the door, and then the staff person will take your temperature, and if you don't have a fever and if you don't have any of the other symptoms, we let you into the second door and you can sit in the waiting room till the healthcare professional calls on you for your turn of the dental work needed. Now, this is something that we are implementing right from today because once a client is in, we want to rest assured, or we want to make sure that they understand that everyone in there has been screened really well. So it's something new that we're adding in, at least till we know otherwise, or unless we've been instructed otherwise by Service on Health Ontario or our governing body. Now, once the client is in, of course, it's what we usually do, which is the universal protocol of taking care of all the sterilization and such. We have equipment like autoclaves and sterilogs that make sure that each and every instrument used in your mouth is not only disinfected, but it's sterilized. And also we use something called a spore tester to make sure that you're getting the best care. If you have any questions regarding any of these protocols that we're implementing, or if you have a suggestion, you can always give us a call or send an email, and we'd be glad to help. Again, stay vigilant, and thank you so much for watching.